Hello, welcome to Tuesday Talk with a Therapist. I'm your host, Felicia Cameron, a licensed clinical social worker for the great hospitality state of Mississippi. I'm the owner and founder of Lending a Hand, where I provide mental health counseling service for individuals dealing with anxious thoughts, anxiety, depression, and coping with life transition, meaning it's coping with adjustment with work, school, grief, trauma, but I provide counseling service. And guess what? I'm on the couch today for Tuesday Talks with a Therapist. On the couch today that I in my office. And today I want to talk about we all have that relative. This month, May is talking about mental health awareness. And we all have that relative, and I talk about labels. Many times when people hear mental health, they think about, I would say in our culture, they think about someone who's dealing with that relative that we have. And that relative, first I want to tell everyone who's joining in, thank you if you can. Put a comment, let me know you joined in. I appreciate it. But we all have that relative. When I say that, we think about mental health, that relative means that person that we consider as someone might call in the family the crazy one, you know, uncle this person, or aunt this person who, when we hear mental health, we think immediately the person in the family that maybe, as we said, not wrapped too tight. They might hear voices, see things, or we might say they schizophrenia, they bipolar, that paranoia. When we hear about mental health, sometimes the image, the label come in our head is the crazy person in our family, as sometimes we call it. That's how we call it sometimes. That image come up, that label. But I want you to think about this. There's a label that come into your mind when you hear about mental health. But what if you think about mental health in a little bit different ways? I know many times people say, well, I don't want to go to see a therapist or see a doctor because I don't want nobody diagnosing me or putting a label on me. And that's true to sense, but I want you to think about this. You don't want to go see a therapist or a doctor to be diagnosed with anxiety or depression, to have a label on you. But I challenge you to think about it. Think about the labels that you already put on you. You can look at this in a lot of ways. We put labels on us in the clothing we wear, the shoes we wear, the purse or tote that we carry. We put labels on ourselves. But you don't want to see a therapist or a psychiatrist or a doctor to get diagnosed and know exactly what you're working with because of a label. It's just something to think about. You wear labels on you all the time. And many times you put the own labels on yourself. It's like, how can someone know what to treat or what to deal with if they don't know what they're working with? If you have symptoms of a cold, how do I know you have a cold unless I label it's a cold to give you the right pathway on how to treat it? So when we hear about, we all have that relative, we think about mental health as the person in our family is very extreme with mental health. I know they got something. I want you to take a look at, could that be me? And do I have a concern? You know, am I'm dealing with excessive worry, anxiety? Do I have a problem with, very suspicious of paranoia? Do I have actual issue with substance abuse? Believe it or not, that's as a diagnosis. People with alcohol, drugs, marijuana. Do I have that issue? Do I have depression? It's me always hearing the table mental illness or mental health that I have somebody else in my vision, in my mind. Could that actually be, do I need to look within myself to know if I'm dealing with mental health? Or do I need to change the word? I know mental health is a hard word, but emotional health. And I'm having challenges within my emotions. It's hello, thank you. Hi, Patricia. But am I having challenges with my emotions? And what does that look like? You know, and then also look at it from a different angle. I was talking to one of my clients not too long ago, and they had this realization and process, and like, at the end of the day, Felicia, I hate that I have this mental illness, that I am the one that has it. Even looking at it from that angle, you know, that you have this mental illness, you have this diagnosis, and how do you cope? I want to change, but I can't change. I have this diagnosis. It's a label. We put on labels, we take off labels. It's just a label. Don't let the label stop you from getting the care you need. Okay? So don't let the label of mental health stop you from getting the care you need. If you need to talk to someone, a counselor, a therapist, psychiatrist, get the help you need. Get the emotional help that you need. Don't get so caught up on, I don't want to be labeled. Because at the end of the day, you already labeled. You put labels on yourself. And it's not so much about the label. I want to, like I said, for mental health awareness, I want us to get the help we need and not think about someone else when we hear about mental health awareness, but actually take a look at ourselves and see, there was studies saying that one in five Americans will experience mental health illness in the course of a year. 1 in 25 Americans will experience like serious mental health problems, and even 1 in 5 children. So, as we think about it and the different symptoms of mental health, different diagnoses, can I look actually in the mirror and see myself that I have experienced this emotional health or mental health? So I challenge you, yes, mental health seems like it have a negative label, and I'm not going to discredit that sometimes people have in our culture have been labels been put on them, and sometimes the labels been put on them, push them to a different direction in care and treatment and how they treat it. I do know that it does happen. But I want to challenge you today. For us who are driven by cultural, music, art, design, our African American culture, I want you to challenge you to search how many celebrities that actually have a diagnosis of mental health that we look up to. Because when we sometimes, like I said, when we hear mental health, we think about that crazy aunt or uncle to the side. But if you look up, do a search on Google, how many people, celebrities that we look up to, that actually have mental health illness? I give you an example. If you can't drop it in a comment on a replay, Michelle Williams, Dwayne Rock Johnson, Janet Jackson. These are people who actually, there's Google, you can search them up, how they mentioned they dealt with depression, they dealt with different things, which is mental health. The label, but they got the help, So let's do something about this for mental health awareness. Share the word, get the help out, and I'll see you next time on Tuesday Talk with a Therapist. Thank you.